but I didn't understand just doing one jaw.
Okay, well, the bottom jaw, we can bring your lower jaw forward and get your teeth fit matched together. The problem with it primarily is you have a very narrow upper jaw, like we just talked about.
Right.
If I have to narrow your lower jaw to match that, that's kind of a movement, and we don't like doing that because the biggest problem is really upper jaw.
Right.
Now I can do it, but we just don't know the overall effect.
Okay.
And if your desire to get a long-term stable relationship, doing both jaws helps.
Okay. The main thing is just the pain. You know, it's not the look of my face. It is mainly just the pain. You know.
Pain what, after surgery, maybe?
No, just that's what I want to focus on is whatever I need to do, the best way to make sure that I'm just not in pain. It's not so much as cosmetic, but
okay.
You know, the pain.
Well, okay, let's talk about the pain then. Where's the pain primarily?
Right here.
Right there, muscle.
Yep.
Okay, let me look at my notes before. Yeah, you have to complain of pain right side. Okay. Okay, well, I think I probably told you this before. That is, I would never go through jaw surgery anyway for joint pain or muscle pain.
Okay.
Or even go through orthodontics.
Okay.
Primarily for that reason. The reason, quite simply, is there's a chance of it not getting better.
Okay.
Even with the surgery.
Okay.
All we're doing with surgery and the braces are getting your teeth so they're functioning normally.
Right.
Now, if you look statistically, yes, most people get better. In fact, about 50 to 60% get better.
Okay.
The problem is, if you happen to be in that 40% don't get better, it's going to be frustrating to you. Because
Right.
you go through all this treatment, plus the surgery,
Right.
and then you don't get better, you'll be frustrated and
Right.
mad at me. And
No.
but I want you to understand that. Now, we do everything to improve on that.
Right.
And put you in a good position, but the reason you should be going through surgery is getting the bite correct.
Right.
Obviously, we're concerned about aesthetics, because if we're going to do jaw surgery, we have to worry about how you look
Right.
afterwards, because we're going to change things. So
Then I guess my not just the pain, but making sure I'm comfortable.
Yeah.
I guess is the better.
The thing is that I can't even be sure you're going to be comfortable.
But if I have a
but-
place for my teeth.
Yeah, if your
to
teeth
sit.
are coming together, that's right.
Right.
Generally, in most, that's why I have to reassure you that yes, it's likely, if you look at statistically the studies. The problem is like I said, I've been doing this for many, many years.
Right.
And had people get frustrated with it after going through the whole thing, nothing improved, because a lot of the things contribute to it. The
Okay.
lifestyle, other pressures and everything else contribute to this type of pain. Now, obviously, structurally, yes, that's contributing to it.
Right.
So bringing jaws in a good functional position should be a benefit,
Okay.
but we're dealing with human beings, and human beings are unpredictable.
Yes.
So just be aware of that, okay?
Okay.
But yeah, doing both jaws, we do from the studies we have been done, it appears when you do both jaws, you seem to get better result relative to muscle pain and jaw joint,
Okay.
because it being balanced out the way the teeth come together,
Right.
okay? So just review with you. With the surgery, as you know, you got to start on braces.
Mhm.
Probably about a year of braces before surgery.
Okay.
Surgery's done in a hospital. It's an overnight stay.
Okay.
Come a day of surgery, go home next morning. Worst thing about jaw surgery is the swelling. Lasts at
Right.
least 2 weeks.
Okay. Well, that's better than I thought.
Pain, even at 2 weeks, there's swelling you'll notice because you know your face. Which
Right.
always be out in public, not a problem.
Okay.
Pain, there's the surgery pain. Generally not a big complaint, although it varies widely. But
Okay.
most people are taking over-the-counter drugs, aspirin, Tylenol, Advil, within a couple of days after surgery.
Perfect. Okay.
Of course, all surgery done through your mouth. Use little plates and screws to hold the bone in the correct position.
Okay.
Allow you to start functioning right away. In fact,
Okay.
we want your jaw moving.
Okay. So it won't be like wired shut
Not
or
really
anything.
wired shut. No,
Okay.
No, I want people on soft foods within a week. You don't get back to completely normal diet, raw carrots, for at least 8 weeks.
Okay.
But other than that, I want you functioning.
Okay. Wow. Much
Yeah.
better than I thought.
Absolutely.
Yeah. And that's about it. We've talked about the jaw joint, so yeah.
Okay. Yeah, Dr. Bruner showed me So before and after pictures of a patient, and
Sure.
then also the hardware inside. So yeah.
So I will definitely get back to him.
Okay.
The decision on whether to take the tooth out is up to between you and he.
Okay.
But whenever I consider upper jaw surgery, I prefer not.
Okay.
But because you're missing no teeth, and you're actually missing both of them. Yeah, those teeth taken out when you're young.
Mm-hmm.
Yeah. Okay.
I think just two. Was there just 2 teeth taken out?
Yeah,
I
plus
think
your
so.
wisdom teeth.
Okay. And then I know I've asked this before, but it's not much of a big deal, but the possibilities of losing the feeling.
The numbness?
Yeah.
Yes. Oh, that's right. Yeah. The chance of numbness, permanent numbness, lip and chin, is 5%.
Okay.
For an adult. It doesn't affect the way you look or talk or anything, just feels weird.
Okay,
And
so
it's
it's
usually
still
one side or the other. Normally, after long-term, we will have one side pretty normal, other side, one side normal, other side slightly diminished.
okay.
So it's disconcerting.
Okay.
Actually, I've seen a number of patients for some reason. I had a plethora of people come back after 15, 20 years, and they said they had numbness for over a couple of years, and then something else they didn't notice to have it.
Right.
Now it's probably because if we tested, we'd probably still find the numbness.
Mm-hmm.
It's just that the nerves fill in a little bit, and then the brain also takes over and adapts to it.
Okay.
So, so generally it's not a problem. Right after surgery, yes, it feels disconcerting.
Right. So I
But
won't
just
be
be aware.
drooling for the rest
No,
of my life.
no, you don't get drool. No, you don't. No, you'll get back to normal if you don't drool.
Perfect.
Yeah.
I guess those are actually better answers than I was expecting, like 3 months type of
No.
thing, or
No, the whole
jaw wired.
Yeah, no, purpose of jaw surgery, modern surgery like this is to get you back to function as soon as I can.
Okay.
So you're not
Perfect.
missing much work or school or whatever.
Okay.
Okay.
Great. All right. Well, then I guess Dr. Bruner and I have a few things to discuss too.
Yeah. So, did we get going on insurance at all before you had Kaiser?
I've changed now, so that's actually one of my tasks I need to do is contact my new insurance company and find out what they'll cover.
Okay, let us do that.
Okay.
You never can contact insurance company and find out what they're gonna cover.
Okay.
We have to send off a letter saying what we're gonna do and why.
Okay.
And there's coding that goes with it and everything else.
Okay.
You don't know who your new insurance is through?
It is Regents.
Through whom? Work?
No, just myself.
Oh,
I just pay for it myself.
okay. I bet you, probably not covered. I'm pessimistic.
Okay.
Small plans generally don't. But the
Okay.
easiest thing to do is for me to get that information. Do you have an insurance card with you or anything?
Oh yeah.
Actually, why don't we get the front desk to take a copy of that?
Okay.
I'll send off a letter to find out.
Perfect.
If there's any chance of getting covered, I'll get it covered, but I just want to be aware as insurance companies.
Yes,
the
that would
federal-
be
Federal law decides what they
okay.
cover and what they don't.
Perfect.
So on the way out, you can get that and they'll get it back to me.